Hi, hope everyone is in good health. So, this is Dr. Prashant Darandale, practicing pediatrician and neurologist at Ghodbandhu Road, Thane. I would like to educate today about your very commonly observed condition in the patients, which are respiratory tract infections. I am sure you would many a time frequently complain of low to high grade fevers, repeated episodes of cough that often produces yellow, greenish sputum, shaking, chills, extreme tiredness, headache, vomitings, muscle aches, loss of appetites. These could be some underlying signs of respiratory tract infections. In India, every year respiratory tract infection accounts for around 30 to 50% of the visits to a doctor, and 20 to 40% of the admissions are due to respiratory tract infection. It affects all ages, be it small kids or adults, and our elderly people. But effects can sometimes be life-threatening under children who are less than 5 years old. Respiratory tract infections is a common infection of the nose, throat, upper respiratory tract, upper airway passages, lower airway passages, which make up your lungs. The most common type of upper respiratory tract infection that we face in a common day-to-day life is the common cold that usually gets better on its own without medical treatment. However, in few instances, it might lead to severe infections such as infections like bronchiolitis due to different viral infections or bacteria, viruses or fungi. You are likely to get severe infection if you are a very young age old child or very old, you have close contact with others who are suffering from such type of diseases, at work, at school where our children go, at playgroups, at creches, at hospitals, have chronic diseases like heart diseases, or somebody has lung diseases like hyperactive airway diseases, asthma, or recurrent respiratory tract illnesses, or some allergies which they do not know. Sometimes it's bird fanciers lungs and what we hear dying of pigeon droppings. Some people have weak immunity. Some people have poor nutrition, who are low for age, who are malnourished children. If we keep talking about children, respiratory tract infection caused by viruses are usually self-limiting and require only symptomatic children. This year we are seeing a syndrome of many bacterial and viral infections, more of viral sorts, which are coming day to day because of 2 years we lost in our COVID. Everybody was sitting home. Our immunity levels have gone down. Now we are exposed. Now we are not using any mask or not taking any precautions. So we are exposed to more viruses. Somebody is sneezing, somebody is coughing around us. That is the reason we are getting infected. Repeated infections before children going to school. This year, most common thing we notice is when a parent says my son or my daughter goes to school, she gets ill, she comes back, she takes medicines. When she's better, she again goes to school and again she is back with the same fever. And these are many a time self-limiting. Takes about 3-4 days. Sometimes where it takes around a week or 2 weeks. What we have to keep here in mind is breathlessness, some signs like decreasing saturations, decreased feeding, not eating well enough. And these are some signs which will tell you that now you need to reach your doctor, and never postpone the thing. Today we will take or tomorrow we will take. No, if you feel something is not right, you have to take it. So symptomatic treatment may require medicines if the patient experiences severe symptoms, and timely medical advice is always very useful for the right diagnosis and right treatment. Treatment may be just self-limiting, assuring, or home-based remedies, but you need to be under medical supervision. That is important, and don't self-medicate yourself with over-the-counter medicines or any home-based medicines that you might feel. If you follow some instructions at home, which include drinking of lots of water to keep yourself hydrated, good nutrition, having lots of fruits, have a good night's sleep. That's important. You have to see, is there some mouth breathing, some snoring, or some OSS, obstructive sleep apneas, why your children is having facing problem, are some dust allergies present at home, any pet is there, any dampness in the walls, or your AC, is it serviced well, are there any pigeon droppings there. These are all small minor factors which is around it. We live in a labile environment, so we are affected by the environment most often. So factors around you cause problems around you and in you. So this has to be dealt in a proper holistic manner. Okay, get good rest, hydration, stay at home when you're not well. Please don't send your kids to school when they are not well, citing the examples of examinations and all. Because if one child goes to school and if he is not well, he will infect the entire class, and slowly, when he'll again go, when he's better, somebody else will infect him and cause the infections. We have the COVID has taught us so many things. One of those is that when you are not well, you should give rest to your body. Rest yourself, drink lots of water, and take proper medicines, and just monitor for the signs. Not every disease or every symptom requires any medicines. Doctor might give you sometimes some antivirals, some antibiotics. He might tell you to test some swabs to let know where you are heading to, what's your diagnosis, so that you may know tomorrow if you are really suffering from something. You might have some late complications. In addition, it is very important to complete and follow the medical advice as it is. It's not like that take medicine for 1 or 2 days, child is feeling better, stop it off, you don't need to have those vitamins, my child is not taking the medicines, and these medicines are too much viscous, I cannot have it, my child is not taking it. Please complete the entire course of the drug which is given and treatment to give maximum benefit, and contact your children when the symptoms get worse and right away. Thank you very much.